The region has already been working on something called the Prosperity Initiative. What that is looking at areas, neighborhoods that are in most need of assistance. Using data collected from Statistics Canada, from the education system, from the health system, and data that we have here at the region, we've used specific indicators to identify those areas across our region that are of greatest need. If you can't get the kid out of the starting block, how are they going to be able to finish the race? And that's what this does. It concentrates efforts at the start of the race, at that part of the race that is most crucial to getting kids to be what we want them to be in the future. That's what this report is, and that's how it will help Niagara.
I think with the quality of the staff that we have at Niagara engaged both through community services, public health, and the region generally, we really are equipped to move forward with this. And as a matter of fact, we would like to see Niagara chosen as a site for a pilot project to move this forward.
In healthcare, we see a direct correlation between education levels, income levels, lifestyle choices with the utilization of healthcare resources. The better educated, the more income, they use less healthcare resources. So this investment in early childhood education will certainly have a dramatic payback in terms of reducing the longer-term social costs, not only of healthcare, but welfare, unemployment, addictions.
We can tell you today where the target schools are that have the greatest need. We can tell you as well that in most of our schools in Niagara, because of our demographics, there is space. Because we have the declining enrollment in most of our schools, we do have the space, we do have the capability of providing these services faster than areas that might have to have capital expansion.
My son attended a full-day senior kindergarten pilot at his school last year, and it was such a fantastic experience for everybody involved. One, from of course the transportation aspect. Developmentally, it was incredible to watch all the things he could achieve and do, the relationships that he built having been there all day. He was quite proud too, coming home with all the new things that he could show me at the end of each day. By the end of the year, he was reading an entire grade level above what was expected of him at the time.
We made a decision before we bought our home that we wanted to buy a house that was in a neighborhood that had a school that had daycare inside. So although that may have restricted some of our choices in the housing that was available to us, the big one for me is the security of knowing where they are all day long and knowing that they're not lining up to get on a bus or to take a cab to go across town.
Provincially, we do know that this is one of the areas, Niagara is one of the regions that need these kinds of supports. And we've been very aggressive in making sure that we get these programs. In fact, this program here, the Parent and Family Literacy Center, is a program that we aggressively went after to get 4 programs in Niagara so that we can advantage these kids. And they're turning out tremendously.
Niagara Catholic is the only school board in the entire province of Ontario that is an Ontario Early Years provider. We have an OEYC site at Mary Ward Catholic Elementary School in Niagara Falls. And that site, together with our early years centers, the Best Start programs that we are involved in, and our full-day kindergarten programs, really solidifies that Niagara Catholic believes in the very important notion of our schools being community hubs.
For Niagara College, we're particularly excited because we've been in early childhood education for many, many years. We have an outstanding group of faculty that have developing early education programs for many years. We have our 2-year diploma, early childhood education, and 5 or 6 other related programs, resource teacher, apprenticeship programs that really speak to the important, highly skilled nature of early childhood education.
There are many positive aspects to this type of initiative. You know, here at Brock, we study just this. We, in our Lifespan Institute and in our Child and Youth Studies Department, We've dedicated many researchers to the whole question of the effects and the environment in which children develop and what those effects are on a lifelong basis.
Niagara has two sides to it. It has the beauty of its natural scenery, its attractions and so on, but it has people who are struggling. And from my point of view, the early childhood program that is being presented here is going to be as significant a legacy of this government as the Bill Davis Institution of Colleges.
We can really place ourselves well ahead of other larger municipal regions in this province because of our capacity to work together and our will to work together and to speak for one voice in arguing for the needs of the region.
The will is here in Niagara. I think we have an opportunity to seize the moment and really be a leader in Ontario for implementing the Pascal report. So we look forward to working with our community partners.
We believe it's the right thing. We have I believe, the enthusiasm, the passion, but we also have the commitment and skill of our staff, and I think that's really important, and it's here.
There are community leaders, broad brush strokes of community leaders, who want this, who recognize that it's children first, that we have to get the children in the starting blocks and all running in the same race. So that's why Niagara should be part of this pilot. That's why Niagara should be first to do this, because we're ready for it.